2 years ago, as people gathered for New Year's Eve celebrations, a new global threat emerged. WHO's health emergency system immediately swung into action, establishing an incident management support team to run the emergency response and requesting more information about the reports of a cluster of cases of pneumonia of unknown origin in Wuhan, China. Although we had little information, we had enough experience and expertise to know that this looked serious. Early on, we worked out that beating this new health threat, a new coronavirus potentially capable of spreading quickly around the globe, would require three things: science to both understand the pathogen and find solutions to beating it, and solidarity to share and deliver those tools wisely and equitably. Science, solutions, solidarity. And there were major successes. This includes the rapid development of a comprehensive package of technical guidance on how to ready countries to detect, treat, communicate, and prevent the spread within 2 weeks of the first report of the cluster of pneumonia of unknown cause. The sharing of the genome, which triggered the development of diagnostics within the first 3 weeks of 2020, a multi-organizational supply chain system was quickly set up, which included solidarity flights that collectively delivered personal protective equipment for health workers and medical and oxygen supplies for patients. WHO quickly convened scientists and researchers in January 2020 and regularly, therefore, to develop a research roadmap for COVID-19 that accelerated the science around the virus and the creation of new health tools. This included global solidarity trials on new vaccines and treatments to speed up research and development processes. And WHO and partners created the COVID-19 Tools Act Accelerator in April 2020 to accelerate access to tests, treatments, and vaccines. We deployed emergency response teams to support governments in their times of greatest need. Working with clinicians and practitioners around the world, WHO developed a comprehensive living guidance for the clinical management of COVID-19. A common corticosteroid was found to be effective in cutting the risk of death in those with severe disease in September 2020. The development of new vaccines proved so effective at cutting serious disease and death, they represent a scientific masterclass. The increased level of coordination between WHO and member states is exemplified by more than 3,500 national regulatory authorizations in 144 member states following the approval of vaccines through the WHO Emergency Use Listing, EUL. However, while science delivered, politics too often triumphed over solidarity. While there were 1.8 million recorded deaths in 2020, there were 3.5 million in 2021, and we know the actual number is much higher. This is not to mention to the millions of people dealing with the long-term consequences from the virus. Populism, narrow nationalism, and hoarding of health tools, including masks, therapeutics, diagnostics, and vaccines, by a small number of countries, undermined equity and created the ideal conditions for the emergence of new variants. Misinformation and disinformation, often spread by a small number of people, have been a constant distraction, undermining science and trust in life-saving health tools. In the huge waves of cases currently seen in Europe, And in many countries around the world, misinformation, which has driven vaccine hesitancy, is now translating to the unvaccinated disproportionately dying. It's vitally important that the established scientific advisory group for the origins of novel pathogens can develop a pathway for the scientific research, search of pathogens, including for the origins of SARS-CoV-2. And we hope to see progress quickly in the new year. In 2022, WHO will work with our member states to build well-financed health systems, strengthen preparedness, and ensure the equitable distribution of health tools. From the new WHO BioHub system, which offers a reliable, safe, and transparent mechanism for WHO's 194 member states to voluntarily share novel biological materials, to the new WHO Hub for Pandemic and Epidemic Intelligence based in Berlin, WHO will build mechanisms to enhance partnership. In this vein, the development of a new binding accord between nations on pandemic prevention, preparedness, and response will be a key pillar. I hope to see negotiations move swiftly and leaders to act with ambition. This is the moment for leaders to banish the politics of populism and self-interest, which are derailing the COVID-19 response and threaten to undermine the response to the inevitable next disease X. While 2021 has been hard, I ask everyone to make a New Year's resolution to get behind the campaign to vaccinate 70% by the middle of 2022. We have 185 days to the finish line of achieving 70% by the start of July 2022. And the clock starts now. If we drive this campaign together, we will all be in a much better place by this time next year. Happy New Year.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.